Good morning. This is Jessica Stone, Community Relations Director for Mitchell County Hospital. Thank you for joining us this morning for Ask the Experts. Joining me this morning is Dr. Dee Roach and Jennifer Hale. Jennifer, as more businesses are opening up, are there any changes that we're going to be seeing at the clinic?
Yes, I know y'all have been aware of the segregated hours that we've had for well visits versus sick visits, and we're going to be extending those hours for the well visits. You can have appointments from 9 to 12, and then we'll also have appointments for well visits from 2 to 3, and our sick visits will be designated for 3 to 5. We just wanted to continue to make patients feel comfortable while coming to receive care, and just let you know that we're still here to take care of you, and we want to do that. We want to give you as many opportunities to come in and keep your health on track.
Thank you. And Dr. Roach, what has the medical community learned from this pandemic?
Since its initial occurrence here, the medical community has learned an enormous amount. This has been a very fluid situation since its onset. To begin with, the first thing we learned about it was the very nature of the virus itself. We've been able to establish its specific genome or genetic sequencing to determine that this is in fact a new virus, something we've not seen before, which has made it somewhat challenging for our systems to respond to. We now have improved methods for determining and identifying its infection through different testing mechanisms, including the nasal swab test, which is probably the most accurate and reliable. We now have antibody testing, which I think is a good adjuvant mechanism to test for the virus. So all these things have been evolving since its first occurrence. Symptomatology or presentation of the disease, we've learned that it's not necessarily just a respiratory infection, but it also can involve other systems in the body, including the GI tract and the genitourinary tract as well. I'm sure everybody's familiar with all the efforts that we've made in finding a magic recipe to treat this with, including antiviral medications, anti-malarial medications, and of course those are still in FDA testing for approval. And then of course finally the evolution and development of a vaccine that's going to be effective and available worldwide, I think, is probably the greatest challenge still facing us. I think the biggest thing that we've learned about this infection, though, is not necessarily how to recognize it, but exactly what the effects of it are on our body. Initially, we thought it was just another virus where the viral particles invaded the cell, killed the cell, and that's what caused the disease process. What we're learning now, particularly from a study that looked at some autopsies that were done in Italy, what's actually happening is that those people who are having the worst outcomes and fatalities are due to a profound immune response from our own body, which causes an extreme inflammatory response in the endothelial layer, which is the inner layer of the smallest blood vessels, which causes limitation of circulation to those very sensitive organs. So it's actually our own body's immune system that's actually in some instances causing some of the poorer outcomes. The implication of that obviously is that our treatment mechanisms for that are more geared now toward anti-inflammatory medications, including corticosteroids, and medications to enhance or encourage blood flow through those compromised and inflamed blood vessels, such as anticoagulants. So again, this is a very fluid situation, but we're learning as we go.
Thank you, Dr. Roach. And thank you for joining us for this week's episode of Ask the Expert.